stop eating the small portions frequently during the day. I mean, what is this? What kind of dietitian she has been talking to? But I mean, what this woman needs, it's the opposite. Today we are doing 5 different case studies with using a GI map clinical test to interpret the IBS symptoms of 5 different patients. Number 5 is one of the most interesting cases, so stick to the end of this video to get all 5 cases. So I'm sharing my screen with you today. So these 5 cases are all from using GI map stool testing to kind of figure out what's going on, to help us find out the truth about the root cause behind IBS. So let's start with the first case. So the first case was a female of age 37, and it was a case of a female that was really underweight. She was diagnosed earlier with an autoimmune disease called ME, and it was a genetic illness in the family. Beside that, she was low in vitamin D and B12, and she was experiencing extreme symptoms of histamine intolerance and food allergies. She also experienced blood in stool, diarrhea, low appetite, and she had a very restricted diet because of the food allergies she claimed. She earlier was tested using clinical tests. She had this metabolic test to find out how metabolism is functioning, and also a stool test, but both found that she had some dysbiosis. But nothing else in particular was shown in these tests. And other than that, she kind of has experimented with a lot of things herself and finds out that yoga and cognitive therapy is helping her, which could indicate that she could have some problems with the vagus nerve not sending the right signals to the digestive tract, creating some problems for her in the stomach and in the intestines. So let's see what the results are of her GI map test. This is the first page of the GI map test, and it shows no severe infection. So the first page always shows the pathogenic bacteria and also some types of pathogenic parasite infections, and there is none of these. So she has not anything in particular that could be related to a gut infection. The next page, she has no Helicobacter pylori. Well, she has tested a little bit here on top. You can see that there is a little bit Helicobacter pylori, but it's not an overgrowth. So that's not something that she should be treating, because it's normal to have Helicobacter pylori, but if it doesn't indicate an overgrowth, then it's no problem. But if we look at the commensal flora, so this is the probiotic bacteria and commensal flora, which means it's normal flora that should be there, it shows that it's really low. So I'm thinking that this patient has some really big issues with her microbiome being very low in diversity. So it's for us humans to function properly, we need the commensal flora to be present, and we also need a lot of diversity in the commensal flora to kind of help us digest the food, to produce some serotonin, which is the happy hormone, we call it, and also to produce short chain fatty acids that we use for our nervous system and a lot of other things in the body. It's very low, which means that she should be working on her diet, and she should probably also go for some probiotic supplementation. So I actually was not very shocked about this, because this patient really restricted her diet. She doesn't eat very much. She only eats some particular foods that don't give her a reaction, and really not very diverse. She's very picky, about her food, and I actually thought that this might be a self-induced problem because she has been very restricted with her diet, meaning that she has not been eating a variety of food that could contribute to her gut flora kind of being in balance. So yeah, let's see the rest of the test. The next page is the dysbiotic bacteria. We call it opportunistic dysbiotic bacteria. And she has some overgrowth of some types of this dysbiotic bacteria. It's not bad, but yeah, there's something to work with here. So some types like streptococcus and staphylococcus and bacillus, and then there's yeast bacteria. There is no sign of yeast bacteria like candida being overgrown here, so it's pretty much the other types of normal dysbiotic bacteria. So this type of bacteria sometimes can contribute to problems with gas, with stomach gas. Next page of the report, there is no parasitic infection with the protozoa parasite, but beta-glucuronidase, this is an enzyme that is produced by imbalanced bacteria in the gut. And what it does is that when the liver decides that this toxin or waste product needs to go out through the digestive tract, out with the poop, it sends this toxin to the colon to kind of get rid of it. What this beta-glucuronidase does is that it changes the structure of this toxin, which means that the toxin then can be absorbed through the wall of the intestine and into the bloodstream and kind of circulates in the body. So when the beta-glucuronidase is high, this means that you have problems with getting rid of toxins from the body because it always kind of blocks this pathway where it changes the structure of the toxin, can be absorbed again into the bloodstream, and then it circulates. So it's not good that this is high, but when you get rid of imbalanced bacteria in the gut, the beta-glucuronidase can go down. So we don't need to treat it in this case. Only if it's chronic, then you can use other supplements to kind of get it down. You can use some supplements that blocks beta-glucuronidase. But right now, I'm just thinking when she gets rid of the imbalanced flora, then it can go down. And another thing that I also that also caught my eye was the very, very high zonulin. And zonulin, it can mean two things. It either means that you have a leaky gut, or it means that you have an autoimmune response. And I think because she has, of course, this autoimmune disease, that of course the zonulin can be related to this, but the zonulin can also be related to the commensal flora being very low, because what the bacteria does is that if you don't give it a diverse option of foods to eat, then the bacteria starts eating the lining of your gut. It kind of starts to eat you. So if you don't give a variety of food to the commensal flora, the commensal flora then, it has to eat, so it starts eating the mucus and the lining of the gut, and this can create inflammation and it can lead to leaky gut. So maybe it's autoimmune response in the body, but maybe it could also be a case of leaky gut. So my recommendations for this patient was that she needs to have some more diversity in her diet and start eating a lot of different foods, different vegetables and different fruits for her commensal flora to kind of blossom again. And then also I think that she should avoid high inflammatory foods like gluten and processed foods like seed oils. And she should slowly reintroduce some probiotic foods and supplements into the stomach again and into the gut flora, because she really needs some probiotic bacteria in her intestines. And she should focus on mental health and cognitive therapy. I didn't recommend SIBO diet for this patient and no herbal supplements, because I think that SIBO diet is very restricted diet and it's used to get rid of SIBO really, really fast. But what I think this patient needs is, she doesn't need a restricted diet. She actually needs to eat some more foods. And I don't think that herbal supplements are the right thing to do, because she's pretty much allergic to everything. And so if we do herbal supplements, this would probably make it worse for this patient. So no herbal supplements for this patient. I think that this patient needs to kind of start to not be so afraid of foods. This is what the problem is that she's really afraid of food. So she has to stop being afraid of eating food and start to kind of build up slowly, and also gradually introduce some probiotics. Next case is a female, age of 45. This patient has history of acid reflux and also has work-related stress. She was earlier diagnosed with gastritis and also experiences a lot of bloating and then a lot of diarrhea and constipation, which kind of goes from one to another all the time, shifting from diarrhea to constipation. She has low appetite. She experiences histamine intolerance and food allergies. And she actually makes pretty good healthy diet choices. It's mostly low carb diet. So let's see the first page. The first page shows that she has an infection with pathogenic bacteria called E. coli. So she has a gut infection. So I'm thinking that a lot of these problems that she's experiencing is pretty much from this gut infection. But let's see what the rest of the test is indicating. Helicobacter pylori is negative. But what's interesting is that her commensal flora is very, very low. So I'm thinking that this patient also needs to do some diverse food. It looks pretty bad with the commensal flora. I mean, it's everything from lactobacillus to bifidobacteria and other types of commensal bacteria being very, very low. The next page is for the dysbiotic bacteria. So it's not a case of severe SIBO infection. It's pretty much the E. coli, I think, that's creating the problem. There's no protozoa parasites, which is nice, but elastase, which means that it's the total amount of digestive enzymes that are present inside of the digestive tract. In this case, it's very low. Not only does she have a E. coli infection, but she also has low digestive enzyme, meaning that she cannot properly digest the food that she eats. So this is not that severe, but I think that when she fixes the gut flora, this will again be normal. So she could do some digestive enzyme in the beginning of the treatment, but not something that she should do forever. Just to kind of help her out in the beginning of the treatment. And also her secretory IgA, which means immunoglobulin. This indicates that it's very low, which means when it's very high, it means that you have a lot of inflammation. But when it's low, it means that the immune system kind of shuts down and it doesn't even react to the inflammation anymore, which could probably mean that she has had this infection for a very long time, and the immunoglobulins stopped working altogether. So nothing else there. So what the recommendations were for this patient was that I think definitely that she should contact her general practitioner to kind of help her treat this E. coli infection, because I think a lot of the problems that she's experiencing is because of this E. coli infection, and of course also because she cannot digest her food and she has not enough of the commensal flora to kind of help her be healthy and have a healthy gut. So she needs to increase the probiotic foods and supplements in the diet, and she needs to continue with the low carb diet, not necessarily a restricted diet, but just to continue with the low carb diet. I think it would be okay in this case. And she should definitely reduce stress and focus on cognitive therapy, because I think that will help her nervous system to kind of communicate with the gut and send the right signals to digest the food properly and so on. Next case is a female, age of 24, and this patient was also very different from all of the other patients because she was young and she had a long history of IBS symptoms, so kind of a chronic IBS situation. She was experiencing bloating, diarrhea, and fatigue, low energy. She also had some eczema, food allergies, and she also had recurrent UTIs. She was a vegetarian, and she also earlier struggled a lot with anxiety, which could mean that this case could maybe be a cognitive problem. I have done another video on this where I talk more about how mental health and how the nervous system can impact our gut health, and how this sometimes can result in the gut shutting down and not receiving the proper signals and creating a lot of problems in the gut. So let's see the test results for this patient. The first page, it's negative, so no infection by pathogens or pathogenic parasites. So this is good, no severe infection. Next page, she has Helicobacter pylori being overgrown, which should be treated. So this is new information that we can use, that she should treat this Helicobacter pylori. Probably this is creating the diarrhea and the low energy and fatigue. So definitely something that she should be treating. If we look at the commensal flora, it actually looks very, very nice. There's no imbalance. There's only one thing that she could do better, and it's the Akkermansia. There's this fantastic product called Akkermansia that can be used for people that are low in Akkermansia. I will put a link in the description so you can check it out and see this product, where you can supplement this product, because the Akkermansia is very, very difficult to find in supplements. She should definitely supplement with the Akkermansia, but in general it looks okay. What she can do is that she can have some more diversity in her diet to kind of treat the commensal flora and make it even better, because the commensal flora loves vegetables and fruits and a lot of these diverse types of foods. The next page is the dysbiotic bacteria, and here we have a little bit of overgrown bacteria, which could also be the reason why she's feeling a little bit bloated and also has problems with diarrhea. The yeast bacteria is overgrown, and it's Candida in particular that is overgrown in this case. So this patient should do some herbal supplements, and I can talk a little bit more about that when I get to the recommendations. She doesn't have any parasitic infection with protozoa parasite, but what she does have is she has low elastase, low enzymatic activity in the digestion, which could mean that she should probably supplement with some digestive enzymes in the beginning of the treatment. the fat absorption is very poor. So there's too much fat in the stool, which means that she's absorbing fat very poorly. This could mean that there's something wrong with the bile from the gallbladder, but it could also mean that she's just not receiving the signals to release the bile from the gallbladder. She could do a bile test to see whether there's a problem with some kind of problem with the gallbladder not releasing the bile, or the liver not producing enough bile. So this can be a chronic condition that can be treated medically. But I think that in the beginning she should focus on the gut flora and try to repair the imbalanced flora and the commensal flora, and kind of see whether that helps. And if it doesn't help, then she can maybe do some testing with the gallbladder and the pancreas insufficiency and so on. So beta-glucuronidase is a little bit high, but this also can go down when you treat the imbalanced flora. And the rest of the test is okay, a little bit higher zonulin, which could mean it could be a case of leaky gut, but nothing severe, not a severe leaky gut situation. So what my suggestions were for this patient is that she should definitely treat the Helicobacter pylori naturally with some herbal supplements. So I don't think that this patient should run off and panic about it and contact the GP and do some heavy antibiotic treatment, because I think that a lot of times you can treat Helicobacter pylori with some supplements. There are a lot of great supplements for Helicobacter pylori that can be used. I have a list of products that you can check out in the description below for treating Helicobacter pylori naturally that you can use. And so there you can always start treating it naturally, and if it doesn't go well, then you can consider contacting your GP, general practitioner, and doing some antibiotics. This patient has a candida overgrowth. She has a SIBO and SIFO, meaning it's a small intestinal fungal overgrowth. And I think that she should do a restricted diet that will help her kind of treat this condition even faster. And I also think that she should do some supplementation, some herbal supplementation for the SIBO and the SIFO. I recommend Candibactin, AR and BR, and this is actually a product that has been very, very successful for SIBO treatment in particular. And when you combine the AR and the BR together, then you both treat the SIBO and the SIFO, the fungal overgrowth. I have put a link in the description so you can see the where you can buy these type of products. And also this patient should do some stress reduction and cognitive therapy, because I think because of the history of anxiety, I think that it could be some kind of cognitive situation where there is some miscommunication between the vagus nerve and the digestive system. And also be very mindful of more diverse food choices for the future, because also she's very picky and there has not been a lot of diversity in the diet earlier for this patient. Case 4, it was a male, age of 32. This man has kind of a recent history of IBS. So there has been 4 to 5 years of IBS symptoms that kind of came suddenly. And he experiences a lot of heartburn and pain in the upper part of the digestive tract. And this can worsen with intake of certain foods. So the symptoms are more related to acid reflux and GERD more than they are classical symptoms like bloating and diarrhea, and so the stool is actually normal, but he's having a lot of problems with acid reflux and heartburn. He has tried low FODMAP diet, but it didn't work for him, which can indicate it's not SIBO. It's not, if the low FODMAP diet is not working, then it's not a dysbiotic bacteria situation. This could be something else being wrong. So let's see the results of this test. And there you have it. The first page, pathogenic bacteria, Clostridium difficile overgrowth in the intestines. So C. diff is a pathogenic bacteria. It's actually a very severe kind of bacteria infection because it can lead to cancer if it's not treated, and if it's overgrown for a long time, it can lead to some severe gut infections. So I'm thinking that this is a case of Clostridium difficile causing a lot of problems. So I wouldn't even call this an IBS case. I would call it a gut infection case. And next page, Helicobacter pylori. It's also overgrown. So there's a Helicobacter pylori infection and a C. diff infection. And together, this, of course, creates a lot of problems. So I think the Helicobacter pylori is probably the one causing the heartburn and the problems with the acid reflux, because this type of bacteria is known to create problems in the upper part of the digestion. So definitely the Helicobacter pylori is creating a lot of problems for him. If we look at the commensal flora, it doesn't look good. It's also low to some extent. So he should be focusing definitely on repairing the gut flora and doing some more probiotics for the gut, and treating this situation with the bacteria infection. So let's go further. He also has a lot of bacteria, dysbiotic bacteria. So this is a case of SIBO, pathogenic bacteria, and Helicobacter pylori, and also dysbiosis. So everything at once, pretty much. The last page is, it kind of looks okay. A little bit of elastase being low, not too low, but it can be repaired if you fix the gut flora, and there also is a little bit of a reaction with the antigliadine, which means that he is sensitive to gluten, so he should cut gluten out from the diet, definitely for a period of time. So, but everything else looks okay. So I think if you treat the infection and you treat the dysbiosis, this patient could be much better. So the recommendations are to contact the general practitioner to help treat the C. diff and the Helicobacter pylori infection. And I think that he should treat Helicobacter pylori with medical products and some medical help, because I think that this Helicobacter pylori could be more severe than some of the other cases, because the symptoms are related a lot to this Helicobacter pylori. And he should do some low carb diet. A ketogenic diet, I think, should be okay in this case. He could do some SIBO diet, but I think the C. diff and the Helicobacter pylori are creating these problems. So that's why I think the ketogenic diet could be a good way to go here with the diet. And introduce some probiotic foods and supplements, definitely. And he should focus on diverse food choices, definitely, to repair his gut flora. I don't think he should do any herbal supplements in the beginning, because I think he should treat the C. diff and Helicobacter pylori through his doctor's office with some antibiotics, and then he should see how it goes. And if the symptoms continue on, then he can consider more restricted diet and perhaps some herbal supplements. Next case is a interesting case because this patient was not only experiencing IBS symptoms, but she was actually experiencing a lot of different things that are not related to the IBS symptoms. And she was very overweight. So there's a lot of things going on with this case. So a woman, age of 37, she was overweight. Symptoms started after an extreme diet change to vegan diet. So she became a vegan, and then she started developing food allergies. I'm not saying that the vegan diet did this. I don't think it did. But you know, she kind of had this drastic change of diet, and then all of the symptoms kind of start showing up. The blood work showed that she had high inflammation of IgM, not IgA, but IgM, which is a more chronic reaction of the immunoglobulins, which means it could be a chronic inflammation situation here. She has high liver inflammation, also shown in the blood work, and also high cholesterol. So a lot of problems with the liver, and she could be like pre-diabetic also. Earlier, she had a breath test done for SIBO, and it was negative. So indicating that this is probably not a case of a dysbiotic bacteria being overgrown, but you know, let's see what this test shows. Experiencing a lot of constant hunger. She's constantly hungry, and she's constantly craving food. She is bloated all the time and has extreme fatigue and low energy, and she has both diarrhea and constipation, kind of switching from one to the other. She has no symptoms of stress or anxiety, which is good. That's very good. So no, I'm thinking that there's no cognitive function problem here. But she was advised to eat small portions of food more frequently instead of regular meals during the day. So get this, she was at this dietitian earlier that has recommended that she eats smaller portions more frequently during the day, because this dietitian or nutritionist, because of her blood sugar going up and down, she should kind of eat more frequently to kind of not have this decrease in blood sugar. So I mean, this is a catastrophe. So let's see what the test results shows. So we did do a breath test for SIBO again, and like before, she tested negative for the SIBO, no SIBO indication here. So this was interesting because she does have a lot of problems that could relate to a bacterial overgrowth, but not as a case of SIBO. So next page is the GI mapped stool test. So the GI map stool test showed that she has a C. diff, Clostridium difficile bacterial infection. So it's a case of pathogenic bacteria infection in the gut. The next page, the Helicobacter pylori is also overgrown. So she also has an infection with the Helicobacter pylori. And if we look at the commensal flora, it's low. It's not that low, but it's some of it's very low, which means that she also has some kind of dysbiosis going on. And also the Akkermansia is very low, which can be repaired with this product that I'm recommending. It's really good. You can find it in the description below. What's it called and where you can buy it. So the next page is the dysbiotic bacteria, and this is where it's very interesting because it's very high. So the SIBO breath test was low, but the stool test is telling us that it's very high. So this could be perhaps that either the test didn't pick up the hydrogen gas and the methane gas, but it also could be that it's a problem in the colon. So it's not an small intestinal bacterial overgrowth, but it could be a large intestine. So it could be in colon that this problem is occurring for her. So a lot of bacteria being overgrown, dysbiotic bacteria, together with a severe gut infection with C. diff and a Helicobacter pylori. Next page of this report, it's the steatocrit. It's really, really bad. She pretty much does not absorb any fat from the diet. So this again could mean a lot of different things. It could mean that there's a problem with the bile or the gallbladder, and it also could mean that it's just the general infection and the dysbiosis in the gut creating the problems for her, that she's not absorbing the fat from the diet. The elastase is a little bit low. It can become better if you treat the dysbiosis. The beta-glucuronidase is really, really high, indicating that the bad bacteria is producing this enzyme which blocks the toxins from coming out. And this is not good. So I think when she treats the bacterial infection, this could be better, but I think she should retest this in a couple of months again to see whether it's still high or it's gone a bit low again. So secretory IgA, as I expected, it's very, very high. So this is a case of high inflammation. The antigliadine is very high, meaning that she's very, very sensitive towards gluten, and she should cut out all gluten from the diet. And the calprotectin is this protein that is present in the digestive tract if there is high infection, and she has high inflammation or high infection, and also she has high zonulin, which can indicate it's a case of leaky gut. This poor woman, I mean, this is really, really one of the tests that I have seen where pretty much everything is positive. I mean, from a pathogenic bacteria infection to Helicobacter pylori to dysbiosis to bacterial overgrowth, and on top of that, not absorbing the fats, low enzymatic activity, high beta-glucuronidase, high inflammation, and perhaps also a case of leaky gut. I mean, this is really, really bad. This woman is really having some issues with her health. Recommendations for this patient was a lot of different things. It was, I think that she should contact her GP and help treat her C. diff and her Helicobacter infection with some antibiotics. So this is very important because I think a lot of these problems are created by these infections with these pathogenic bacteria. So when she treats this, I think that her health, general health, and also her gut health could be much, much better. And also she should do a ketogenic diet because there's so much bacterial overgrowth, and this is why a low carb diet could be very, very good to kind of not feed this imbalanced bacteria further with the high carb foods. Maybe SIBO, but we should be mindful that this patient has a lot of different issues with her health, and the SIBO test did not indicate that there's a SIBO situation. So perhaps not a SIBO diet, but just a ketogenic diet could be okay in this case. So Akkermansia, definitely supplement with the Akkermansia probiotics, and she should do some herbal supplementation, only recommended if the symptoms continue after treatment of C. diff and Helicobacter pylori. And what I also did for this patient, I said, this nonsense with smaller portions frequently during the day, she should totally stop eating the small portions frequently during the day. I mean, what is this? I don't know what kind of dietitian she has been talking to, but I mean, what this woman needs, it's the opposite. It's doing some intermittent fasting. When she's snacking all the time, this is what's, spiking her blood sugar, and she should stop snacking all the time to kind of balance the blood sugar instead. So what I said to her, that she should definitely stop with the snacking during the day. So she should do some intermittent fasting. So she only eats 1 meal or 2 meals during the day, like lunch and dinner, or even just dinner, and that's it during the day. So and eat, of course, eat a great portion, big portion with some low carb foods, and just stop snacking during the day. That could be the best thing for her, not only for her bacterial overgrowth, but also for her blood sugar, not always like spiking the blood sugar during the day. So these were the recommendations for her. And I actually talked to this patient a couple of weeks later, and it was amazing because she did all of these things. She treated the C. diff and the Helicobacter pylori, and she did the ketogenic diet, and she did the supplementations, and also she did intermittent fasting. And the results were just mind-blowing. I mean, she was doing great. She was so happy, and she was just very, very happy. She said that her gut problems were reduced drastically, and she was so much more energetic during the day, and she had no bloating anymore, and she was not bloated, and the normal stool again. And she also said that she has never felt better for a very, very long time after she started with the intermittent fasting. So this has done really, really good things for her. And she said to me, I am continuing doing the low carb diet and the intermittent fasting, and I'm so happy. Thank you for helping me. And I was really, really glad that I have talked to her, and she actually lost a lot of weight. So when I saw her the first time, she was overweight, and the second time I saw her, she actually lost a lot of weight, and she was a lot skinnier and happier. And so I thought this was so good for this patient, because what we actually did for her, we only treated the gut issues, but it kind of resulted in her also losing a lot of weight and just gaining a lot of energy, new energy, and new she didn't have so much fatigue anymore, and she was just a lot happier and healthier. So these were the 5 cases of the GI map test. If you are interested in more videos like this, where I do case studies and clinical test interpretation, remember to subscribe for this channel, and I will keep you updated. So thank you for watching.